So unless you are currently living under a rock, you would know that we are in the state of a national emergency. So while we are all individually being affected by this emergency in several different ways, in today's video, I'm going to talk about how it's affecting dentistry and dental hygienists in particular. So as a dental hygienist, we have the #1 most unhealthy career, and we are quote unquote used to being exposed to various diseases and viruses and bacteria because of the close proximity that we are in whenever we are working on our patients. Now, while yes, we do have PPE that we wear, we have masks and we have gloves and all that fancy stuff, but at the end of the day, there's always loopholes and there's always a risk that we will be exposed to something. So if you're in the dental field, I am sure you have read and seen a lot of these articles, and if you're not, this is going to be some new information for you to get to know. So if you're wondering how this whole situation is affecting the dental field, the answer is that it is affecting it greatly. The virus is currently leaving dental hygienists unemployed. There are so many of us who are without work right now, and there are several different states that are now mandating hygienists not be able to perform our procedures until May, June, and even July at this point. Now, granted, a lot of information can change over the next couple of days, weeks, months, as a lot of information has changed in just the past week. I went from thinking that this was just an overblown, out of proportion flu to realizing that this is actually a really serious problem. Unlike the flu, we don't know what we're getting into. We don't know long-term side effects. So the New York Times came out with this nice article that allows you to look up different professions. Now, in addition to the amount of employees that it states in the annual income, the more important information that it states is our risk factor. It tells you what your particular risk is to the virus. So it is a graph that on one side shows you the exposure to diseases, and on the other side shows you the close proximity to others. Now, you can scroll through the different types of bubbles, or you can simply type in your profession to see what your risk is. So when you look up dental hygienist, you will see that we are at the very tippy top of the chart. 100 out of 100. Literally, there's not a closer spot that we could be to the virus, according to this graph. So according to the CDC, it is spread most likely by close person-to-person contact, about 6 feet. A dental hygienist works about 6 inches from your mouth. Also, person-to-person spread is thought to occur via respiratory droplets that are produced when an infected person coughs or sneezes. These droplets can land on the noses and mouths of people nearby and can also be inhaled into the lungs. As of Sunday, March 15th, the ADA came out with some guidelines for us to follow to help reduce the risk of spreading the disease and our personal risk of exposure to the disease. And the guidelines were some common sense recommendations include screening patients for international travel, signs or symptoms of infection when you update their medical histories, include temperature readings as part of your routine assessment of the patient prior to performing dental procedures, make sure the personal protective equipment that you are using is appropriate for the procedures performed. Of course, they are recommending the N95 masks, which I'm pretty sure no one at this point could get a hold of. Use a rubber dam whenever possible to decrease the possible exposure to infectious agents. Use high-speed evacuation for all dental procedures producing an aerosol. Autoclave your handpieces after each patient. Have your patient rinse with 1% hydrogen peroxide before each appointment. Coronavirus is vulnerable to oxidation. This will reduce the salivary load of oral microbes. And last but not least, clean and disinfect public areas frequently, including door handles, chairs, and bathrooms. Now, come the next day, Monday, March 16th, the ADA sends an email out to every dentist in the organization. The ADA is deeply concerned for the health and well-being of the public and the dental team. In order for dentistry to do its part to mitigate the spread of COVID-19, the ADA recommends that dentists nationwide postpone elective procedures for the next 3 weeks. Concentrating on emergency dental care will allow us to care for our emergency patients and alleviate the burden that dental emergencies would place on hospital emergency departments. As healthcare professionals, it is up to the dentist to make well-informed decisions about their patients and practices. The ADA is committed to providing you the latest information to the profession in a useful and timely manner. So at this point, it was recommended to stop performing any procedure that was considered an elective procedure. And a few days later, they came out with an exact breakdown of what they mean by this. What is considered an emergency and what is a non-emergency procedure. Wednesday, March 18th, the ADA comes out with developed guidance on dental emergency and non-emergency care. Again, the guide states that the association recommends that dentists nationwide postpone elective procedures to do their part to mitigate the spread of COVID-19. It was included as part of the ADA issues alert that went to all dentists in the ADA's database. Dental emergencies, according to the ADA, quote, are potentially life-threatening and require immediate treatment to stop ongoing tissue bleeding or to alleviate severe pain or infection, end quote. Conditions include uncontrolled bleeding, cellulitis, or a diffuse soft tissue bacterial infection with intraoral or extraoral swelling that potentially compromises the patient's airway, or trauma involving facial bones that potentially compromises the patient's airway. They also go on to state that dentists should use their professional judgment in determining a patient's need for urgent or emergency care. So some examples of urgent dental care. This is considered an emergency, which should be treated as minimally invasive as possible, include severe dental pain from pulpal inflammation, pericornitis or third molar pain, surgical postoperative osteitis or dry socket dressing changes, abscess or localized bacterial infection resulting in localized pain and swelling, tooth fracture resulting in pain or causing soft tissue trauma, dental trauma with avulsion or luxation, and dental treatment cementation if temporary restoration is lost, broken, or causing gingival irritation. Other emergency dental care includes extensive caries or defective restorations causing pain, suture removal, denture adjustments on radiation and oncology patients, denture adjustments or repairs when function is impeded, replacing temporary filling on endo, access openings in patients experiencing pain, and snipping or adjusting of an orthodontic wire or appliances piercing or ulcerating the oral mucosa. Non-emergency dental procedures, according to the American Dental Association, include but are not limited to initial or periodic oral examinations and recall visits, including routine radiographs, routine dental cleanings, and other preventative therapies, orthodontic procedures, other than those to address acute issues such as pain, infection, trauma, extraction of asymptomatic teeth, restorative dentistry including treatment of asymptomatic carious lesions, and aesthetic dental procedures. The ADA also states that continuing to work under these circumstances may be both illegal and unethical, jeopardizing their license status as well as their professional status. While providing emergency care to patients may be necessary, non-essential treatment should be deferred until state and local public health authorities deem it appropriate to proceed. A couple of days ago, they were answering some questions on Fox News when a caller who was a dental hygienist called in and asked what she, as a dental hygienist, and the rest of the group practice should be doing to help protect themselves from the virus. And the board-certified physician's answer was that we should not be doing routine dental cleanings on patients. Also stating that we should cancel all non-emergency dental appointments because of the close proximity that we are in whenever we are working on our patients. In addition to all of that, here is some more information on how it affects us personally as dental hygienists. To conform to social distancing, we are supposed to maintain a distance of 6 feet between us and another human. There's absolutely no possible physical way that I can do my job being 6 feet away from another person. Remember, the virus is airborne. So when you think about the stuff that we use to do our jobs in dentistry, our drills, we have our cavitrons, our ultrasonic scalers, and we also polish. All of these things produce aerosols. And if the virus is able to stay in the air for hours, how are we going to disinfect the air? COVID-19 can live on surfaces for days after an exposure. And while we do use some pretty good disinfectants, not everything is approved to be able to kill the virus. After exposure to the virus, you can go from anywhere to a week to 2 weeks before you ever have symptoms show up. And sometimes, in certain cases, they can be so mild that you don't realize that you have it at all. So it's really hard to say that you for sure have not been exposed to it. And if you have been exposed to it, think about that. For everybody. I mean, what did you do in those last 2 weeks? How many places did you go? How many things did you touch? How many times did you encounter another person? There's so many ways that you could have just spread that disease, not knowing that you were ever exposed to it. And another thing is, even if you get it and you overcome it, we still don't know what the long-term side effects are. You don't know if you're going to have damage to your organs or damage to your lungs. Even if you are a younger, healthy person, that does not mean that you are immune. You could still get it. And while you may have a good chance of surviving, there are plenty of loved ones and people that you can be around that you can give it to. Maybe your grandparents won't be so lucky. Maybe an immunocompromised child won't be so lucky. It's not about you. It's about how much you are personally willing to sacrifice to potentially save the lives of several other people. We also were recently told that any life-sustaining business was the only business that should remain open. And as for offices of dentists, they said yes, they should remain open, but elective procedures are prohibited. Now, I don't know if this is just for the state of Pennsylvania, but this is our most current update. So it is currently March 24th while I am editing this, and on March 22nd, the Pennsylvania Department of Health released new guidance stating that dental facilities and offices must close immediately, even for emergencies, if they do not have all the following protective equipment and protocol in place. All personnel must follow proper protocol. All personnel must use N95 masks or higher, goggles or a face shield covering face and sides, disposable gowns and gloves. Treatment must be provided in negative pressure isolation rooms with a HEPA filtration. The Department of Health did not consult with Pennsylvania Dental Association prior to releasing its guidelines, and as of today, the PDA has released their response statement to this. Dear Governor Wolf, on behalf of more than 5,000 members of the PDA, I am writing to express grave concern over the Department of Health's most recent guidelines. It also goes on to say that we have confirmed that even the dental schools do not have negative pressure engineering controls, and most hospitals and federally qualified health centers do not as well. This guidance will effectively shut down most, if not all, dental facilities and offices. Patients seeking emergency care will flood hospital emergency rooms, the very place we do not want them to go. PDA believes that dental offices should only be required to adhere to the latest restrictions found in this guidance when treating patients who need emergency aerosol-producing procedures. Therefore, dental offices may still offer emergency care to some patients. We ask that the department consider immediately issuing another guidance making this modification. PDA is extremely disappointed that the Department of Health did not consult with the dental community or the deans of Pennsylvania's dental schools prior to issuing the latest guidance, which was drafted without consideration of or consultation with these most significant stakeholders. Trust me, when this whole situation started, I really didn't think a whole lot of it, and I didn't really see it as a big deal because at that point people were just saying it was just like the flu. And while a lot of people probably still think that way, the longer that we are in this situation, the more we learn and the more scarier it becomes. But at the end of the day, I mean, all we can do is do our part. If you still get to work, whether you want to or not, just remember that a lot of people are without money right now. And it's hard. What should you be doing to help stop spreading the virus? And that is simply avoid social gatherings of 10 people or more. Avoid eating at bars and restaurants. I mean, at this point in our state, those are all already closed. You can't even go into a bar or a restaurant. Avoid any non-essential travel. So this isn't the time to just go hang out at Walmart or go to the store because Your favorite store is still open. Unless you really need to get something, don't go out any more than you have to. Another thing is avoid nursing homes and retirement homes. Again, at this point in our state, you're not even allowed to go in. And of course, practice good hygiene. If you cough or sneeze, cough into your elbow, sneeze into your elbow, or sneeze into a tissue. This is stuff that I learned in elementary school. Wash your hands for a good 20 seconds. Avoid touching your face and disinfect surfaces as much as you possibly can. So as much as I would love to still be working and taking care of my patients, I know that right now the best thing that I can do to help my patients is to avoid them for their safety and mine. So while you're at home, this is the perfect time to take care of your teeth. You have time to brush your teeth now. You have 4 minutes a day to brush your teeth. You have time to floss or learn how to floss, or start playing with that water pick that you bought weeks ago or months ago. While your dental cleanings are super important, it is not life-threatening for most people at this point. Please just remember to be kind and courteous as much as you can to everyone else. Like I said, we're all going through it. We're all feeling the wrath of it. So just do your part, stay safe, listen to the rules. This is not the time to be a rebel. And I will be adding information as it comes out to this video. So if you want to check the description box down below, I will have all this information listed down there. And I will also, like I said, add more information to it as we get more information sent out to us. I hope that this was helpful and informative. I know this is not a super happy, exciting video like I usually make, but it's important and it's reality and it is what it is. So don't forget to subscribe if you are not already. Hit the like button. I really, really appreciate it. And as always, I will see you guys in my next week's video. Bye, guys.